much for joining the American Ambulance Association for the FEMA Public Assistance Program Overview webinar. It is our honor to welcome U.S. Fire Administrator Keith Bryant, as well as FEMA Public Assistance Training Section Deputy Chief Star Black today. On today's webinar, we will be using the chat box as a primary means of communicating with me, your host, if you're having any technical difficulties with your audio or with seeing the slides on your screen. If you would like to address a question to our expert panelists, please use the Q&A function next door. Because this is a very technical webinar, we will not be taking any live questions from the audience. Instead, all of your questions that are submitted via the Q&A function will be compiled and shared with Chief Bryant and Star Black after today's session. They will be used to help develop an FAQ document that will help you and your fellow EMS professionals as you work to apply for FEMA Public Assistance grants. With that, it is my absolute honor to turn the presentation over to Chief Bryant. Chief Bryant, would you please get us started here?
Absolutely. Thanks so much. And appreciate you all for having me. I understand we have quite a few people on the webinar today, and that's great. First and foremost, I'd like to say hello to everybody and hope that everybody is well and safe out there right now. There are a lot of challenges, obviously, going on today and in various ways, not just with the pandemic, but certainly with some other things that a lot of our communities have been facing. The Fire Administration has, since the beginning of the pandemic, has been doing our best to try and work with not only our federal partners, but a lot of our non-government organizations out there as well, and doing our best to get accurate and timely information out there. So again, we've been working with our partners in FEMA, our partners in Health and Human Services. We've been engaged in a lot of the task force that are going on, both the supply chain and the pre-hospital task force that we've been involved in. So again, trying to stay very involved and engaged in what's going on out there, and that way we have the most up-to-date, accurate information that we can share with you. And that's what we're going to do a little bit today. And, you know, as things have been changing with this pandemic almost on a daily, if not hourly basis, we believe that the information that we're passing on to you today is current as of the 15th. So that doesn't mean, you know, things might not change tomorrow by the end of this webinar, but again, we will be happy to address any concerns, questions. As you were told, if you submit your question to us, we certainly won't end our conversation and discussion with you at the end of this webinar. So we're certainly available, not only for what we're going to talk about today, but anything that you know, that concerns the fire and emergency medical services that we can be of help with. So, you know, no doubt about it, this current pandemic is really unprecedented. You know, we certainly not since, you know, many years ago have we seen something like this that's affecting literally the whole country. It's not often that we see, you know, disaster declarations in all 50 states. But, and that's created some very big challenges for you all and everybody that's working within the fire and emergency services in terms of PPE. I want to address that real quick and just say we know that there have been some problems with that. I would not get on this webinar today and pretend to tell you that everything's been great in that way and that mistakes haven't been made. There's been some probably poor communication, but hopefully things in that regard are improving. Doesn't mean the challenges don't still exist. We know that. The demand is still out there. In fact, in some places, ticking back up again. So we understand that, but hopefully some of those issues in terms of PPE and other resources have improved. I will tell you this. The demand for resources in terms of PPE and other things has not ceased. And in this pandemic being a global pandemic, the demand is absolutely global. And so, even though some things have been put in place and some manufacturing has been started here in the United States, a lot of the supply has not, or most of the supply at this point hasn't caught up with the demand yet. We realize that, and it may be sometime before it does. So again, we will keep working with the other federal agencies and so forth to make sure that we're communicating your needs and hopefully continue to improve that situation. Again, this pandemic, one of the most significant in modern times for sure. You know, the U.S. is undertaking measures that haven't been seen since the 1918 to 20 H1N1 influenza pandemic, which infected up to 500 million folks. So not since that time have we seen the kind of response on a national level and like I said, a global level that we're currently seeing. We understand the impacts in terms of the demands that response is creating, strain on people, facilities, and equipment, as you are very well aware of, apparatus usage. Again, what we're seeing in our INFRS system, the National Fire Incident Reporting System, that EMS calls overall are ticking downward, while structure fires are going up, which that might stand to reason with people being in their homes more than they normally are. But we understand that, you know, there's a fiscal impact to that as well. And that's a huge challenge for many, many communities. And we know that, again, through Congress, they are passing legislation that's providing funding to meet the demands of this response. They're approving supplemental funds and existing grant programs, but there may be some programs that people aren't aware of. And again, that's one of our big reasons for being here with you today, is to talk about public assistance. And maybe not something that a lot of people consider, because again, it is a separate program from the normal grant programs that I think we're all familiar with. And with that, I would like to turn it over to our very special guest today, Star Black, and she's the Deputy Section Chief of FEMA Public Assistance Training. And so she's going to take you through what public assistance is all about, the eligibility, and how you might go about accessing that funding that might be helpful to you during this time. So with that, I'll turn it over to Star.
All right, thank you, Chief Bryant. Today, I'm going to walk you through. Your first question, I know, is probably, is a private nonprofit eligible? I'm going to cover that. I'm going to show you what you need, the yeses, the nos, and all the pieces that have to deal with COVID-19 as we go through this. The first thing I'd like to talk about is, what is a declaration? It's a major declaration. It was issued on March 25th, but the incident period, which is very important to you, is January 20th, 2020. What that means is any damages, we refer to them as damages, so any expenses that you incurred as of January 20th could possibly be eligible, and it's continuing. So those costs, I know the pandemic is still going on, so they have not closed the incident period. So it's very important that if you haven't already, to start tracking all your costs. And I'm going to walk you through what kind of cost we're looking for. The type of declaration, as Chief Bryant put it, we have never had all 50 states, all territories, and tribes be declared at the same time. So this is a monumental event. Of course, the pandemic is something that, you know, we haven't had in quite a period of time. And what we look for, we have 7 categories of work in FEMA under public assistance. And the one that pertains to COVID-19, or that was declared for COVID-19, is what we call Category B, which is emergency protective measures, which is what you do. And I'll define that a little bit more of what are we talking about here. Now, with public assistance, there is a federal and non-federal cost share, which means the federal government would pick up 75%, and you would be responsible for the non-federal, which is the 25%. And that all comes from the Robert T. Stafford Disaster Relief and Emergency Assistance Act, or the Stafford Act, as we like to refer to it. What I'm going to walk you through is what is the process for COVID-19. Now, with private nonprofits, we have a little bit different process because there's some additional forms that we need from you. I'm also going to walk you through the eligibility, some administrative relief. So what's in it for you to put together this package for a grant? What kind of documentation do we need in order to substantiate your cost and to get your grant going through as quickly as possible? And then what do you do after this webinar? So that's kind of what I'm going to take you through, is the big 5 steps. So, all right, let's talk about the, what's the process? First off, let me just define what is public assistance. Public assistance provides supplemental grants to states, tribal nations, territories, local governments, and where you fall in probably is certain types of private nonprofits, so that the communities can quickly respond and recover from major disaster or emergencies. That is the definition of public assistance. Now, what does that mean to you? Again, here is the declaration information. Make sure you jot down the January 20th date and that you mark that it's a 75-25. That's the big thing to remember. The process here, it's a little blurry and I apologize, but you're basically attending a virtual applicant briefing. Your state or may put on a briefing, they may not. But the biggest thing that you need to know is you need to log in to our software called Grants Portal. Grants Portal is where you will upload all your documents. It's where you will be able to track where your grant is, and it's open 24/7. So you'll be able to know where your grant is in the process, who's touching it, any issues. But you got to have an account first. And with private nonprofits, getting the account is a little bit different. So I'll walk you through that process here. But then once your account's established, your account's always established. So you only have to go through that painstaking process once. Then you will need to submit a request for public assistance. What that means is you're throwing up the white flag saying, hey, I want to be on FEMA's radar to get this grant money. The only way you can show up on the radar is by doing a request for public assistance. And you will do that through your Grants Portal account. Then you submit your COVID-19 project documents. What that means is we're going to ask some questions, you're going to input. We've got a big template that you walk through in Grants Portal. It's pretty user-friendly. It's web-based, so if you can just answer questions, put stuff in a box, you're good to go. Then you'll be uploading documents. And I'm going to talk about what those documents are a little bit later. And then you'll submit it. Once you submit it, then FEMA goes through a review, the state goes through a review. We have environmental, looking, at medical waste. We make sure that everything, all the boxes are checked, everything's good. Then it gets to, you will be asked to sign the final grant, and you will know all the conditions that are given to this grant, and then you receive the funding. I will warn you, it is not a super fast process, but then again, getting grants usually aren't. But you will be able to check on it as you go through with your grants portal account. So again, where you find our grants portal software. Now, some of you may have been in a previous event. If you've been in a previous event, then chances are you may have a grants portal account. The website's right here at grantee.fema.gov. Now, if you're a private nonprofit, you will not be able, sorry about that, you will not be able to submit a streamlined application. You'll have to actually go to your state or your recipient to get an account. And that's all you have to do is make sure that you get that account set up. And then you go through entering in the streamlined project information. So the direct assist, you'll be able to go in. We normally do what we call an exploratory call. And then we usually have a recovery scoping meeting where we walk you through the whole process. Well, we have streamlined this process to where you're going to skip all that stuff. You're just going to go straight in, enter in all the information, and then that way it'll go straight to the folks that are processing it. Now, the nice thing is we do have, you know, I would like to say that this webinar will probably give you everything you need to know. Yeah, probably not. But we have some quick guides. We have some how-to videos, and I'll give you that website. We actually have a YouTube channel that will walk you through step by step of how to do this. We also have, for some folks, you know, watching the video is all great and fine, but you want to talk to a live person to walk you through what button do I push? How do I do it? We have a hotline, which is that 866-337-8448. They will be able to help you with the software, the grants portal software. There's also an email box at the end that you will be able to send messages. So, but we're going to get into the eligibility very quickly as we go through. So again, if you don't have an account, go to either your emergency management group, your emergency manager, or to go to the state emergency management, and they will get your account set up for you. All right, what does grants portal look like? Again, this is at grantee.fema.gov. If you are a government organization, you can't, and you don't have an account. Now, again, this is not a private nonprofit, but if you're a government organization, then you can actually bypass the state and be able to click on register a government organization. Here is what for the different levels. So if you're a nonprofit organization, you should, again, first reach out to your local emergency management department or the state emergency management and have them set up your account. And there is, you can visit emergency management agencies. There's a FEMA directory for state and local emergency management offices. You probably already know who those folks are. If not, then you know, by all means, go to the FEMA, FEMA.gov website, and you'll be able to find that. There's also some additional applicant quick guides that will walk you through how to create an account. So we've got plenty of resources that are there for you. And And I know that, you know, a lot of you are in different, different types of organizations. So individuals looking for individual assistance, some folks are, you need to go to disasterassistance.gov. That's not public assistance. Let's go to the next slide so they can see this. There you go. If you're a business, so if you are for profit, that is not our public assistance. You need to visit the Small Business Administration website for disaster assistance. If you are a tribal organization that is applying as a recipient, again, you need to reach out to your FEMA regional representative. But and you'll see those when you click on, go ahead and go to the next one. You'll see all this information when you click in to get into grants portal. So for private nonprofits, you need, again, to go to your emergency management agency to get your account. That doesn't mean that you're not eligible. It's because we require a lot of extra documents in order to establish your account. And it's got to go through our Office of Chief Counsel because they're going to review your bylaws. They're going to review your charter just to make sure that you're an eligible applicant. So that's why you can't do the direct submission to create an account. So, so once you get in, it's going to ask you, are you a robot? And of course you need to check no. So, well, you could be a robot, but let's hope not. So you would check to confirm that you're not a robot. So then what happens is once you finally get your organization in, it's going to ask you to register and do your request for public assistance. What's really important here is we need to know what state, territory, your organization is located in. And then the biggest thing is to select the event. It needs to be the COVID-19 event. Then that will actually start your request for public assistance. So again, you've got to have an account and then go in and do the request. So now you've got an account, hopefully, but who can get an account? As you'll see over there on the right-hand side, we've got applicant, facility, work, and cost. That's our eligibility pyramid. You got to be an eligible applicant. You've got to be at an eligible facility, and I'm going to cover some of this. And then you've got to be doing eligible work. If you get yeses all the way up, then you've got to have eligible cost. So let's dive into this just a little bit. Who's an eligible applicant? As a recipient, and a recipient means that FEMA is giving the money directly to them. That would be the state government, tribal governments, or a territorial government. We give the money to the recipient. The recipient, in turn, gives it to applicants, which would be you. State agencies, territorial governments can also have a grant along with tribal governments, and certain private nonprofit organizations, or as we always refer to them as PMPs. At a minimum, the work, which we call activities, it must meet a required criteria. The required criteria is it's what you're doing just for COVID-19. This is not your everyday call that you get. It has to be specific to a COVID activity. So it's got to be located in a designated area. Well, the nice thing about COVID, I guess if there is a nice thing, is the entire United States, tribes, and territories have all been declared. So it is in a designated area. And it has to be your legal responsibility to do it. That is the critical part. It's not, If you're a private nonprofit, you will have to have an agreement, and we'll get into a little bit more when we talk about specifics and documentation. There is a fact sheet out there and you can just, you can even Google this, or you can go to FEMA's website for COVID-19 pandemic eligible emergency protective measures. These are the things that the work that you're doing. Also, just so that you know, we do have a what we call our Papa G, which is our PA policy and program guide. And you can, again, you can Google PAPPG. And on page 43 of that document, it walks through the entire steps of a private nonprofit. It talks about critical services, eligible non-critical and essential social services. It gives a complete listing. It even gives you this wonderful chart, which emergency services being ambulance, fire protection, and rescue. Those are P&P eligible critical services. So, so that's where you can find a lot of more detailed information. Again, that's on page 44 of the PA Program Policy Guide. So you'll be able to find that if you want more information as we go along. All right, so some private nonprofits may be eligible for public assistance under COVID-19 if you're legally responsible for performing those services. Now, what we mean is that a private nonprofit that owns or operates an eligible facility and performs eligible work. This is doing medical or custodial services, which you're legally responsible to do, which EMS is legally responsible to do it. Again, there's another fact sheet for you on private nonprofit organizations. So again, pull that out, and you'll get a lot more specific information to find out if your organization is eligible or not. So the work, again, we're talking about emergency protective measures, which is what you do. We do during the COVID-19 event. This declaration does not cover any permanent repairs or any debris removal. Hopefully there's no debris removal, but it is just the emergency protective measures, as we refer to as Category B. What is the definition? Emergency protective measures eliminate or lessen the immediate threat to lives, public health, and safety. That's just, it's very generic, so there's a lot of things that can fall into that category. So here's some examples. An emergency operations center, if that had to be staffed up. Medical care and transport, which is where you come in. Supplies and commodities, medical supplies, your PPE, and some other equipment. But it has to be not just what you use on a daily basis. It has to be as a result of a COVID-19 call. So that's where you're going to have to definitely do some sifting to make sure that that's the only piece that you're claiming, not what you do in your normal everyday calls. Also, some additional things that could be eligible. The biggest one here is decontamination of your emergency responder vehicles. So if you purchased and distributed food, ice, water, medicine, or other consumable supplies to include the PPE, those would be examples of things that you need to track, in addition to search and rescue located to recover population. Hopefully you won't have to be doing that, but that does fall in under the Category B. So those are things that you need to go back and track starting as of January 20th. So, you know, here we are almost 6 months into this. So you'll have to go back and do some backpedaling to, if you haven't already started tracking those things. Then let's talk about the cost. To be eligible for reimbursement, it's got to be from eligible work. So that means COVID-19 calls only, and it's got to be adequately documented. Now, the nice thing is you do have a call log. So that call log will assist you, but it needs to be identified somehow that it was a COVID-19 call. Of course, you don't know that till probably you get there. But it needs to be noted that that was not just a normal call that you go out on. Also, we do reduce the cost by any insurance proceeds. And we'll talk a little bit more about that. So you probably won't have any salvage value or credits, but you could have credits from the Health and Human Services that is covering some things, or some other grants that might be covering it. You have to be authorized and permitted under federal law to actually be doing it. It's consistent with your internal policies, your regulations, your procedures. What do you normally do? Necessary and reasonable, well, that's usually not a question with ambulances and EMS workers. So again, we look at reasonable cost and that it's necessary. Now, you're responsible for providing that documentation. And sometimes that's the hard part, because you're in the midst and you're doing and you're going, and then you need to make sure that you are actually documenting which calls are COVID calls. And so we evaluate it for, necessary type of work, not just your everyday work. And there's a public assistance, reasonable cost job aid that's out there for you. Now, the duplication of benefits. This is, I was talking about the insurance piece of it, but we have to make sure that that you don't have two hands in the pocket, meaning that you can't have duplication of benefits. So if someone else is paying for it, funds coming from the Department of Health and Human Services or HHS, the CDC, those types of things, if things are coming from that, then that money is not going to be given to you in addition to, you'll get that money, but FEMA won't cover the same cost. So you will only get funding from one source. Now, if by chance they don't pick up all of it or it's all not covered, then we will review that. So FEMA's assistance in the response to an infectious incident is coordinated with the CDC. So that's why the incident period is still ongoing, because they have not closed that incident period. So go back from January 20th and keep going. Let's talk about insurance, because EMS does get insurance payments from individuals for transportation. If you do receive any payments for that, then that would be reduced from your claim. But if and some insurance policies and parametric policies may provide coverage under civil authorities. So we will actually need a full copy of your insurance policy. We've got some fabulous folks that this is what they live for, is to go through your insurance policy to see what's covered, what's not covered. So generally, the emergency procurement of supplies, nor the establishment of temporary medical facilities, that's typically not insured. So that would qualify for assistance under FEMA. If you're claiming cleanup or disinfecting, then we will look at your commercial property insurance to see if that's covered. Again, we want to make sure that when we issue the grant, that we're not coming back and de-obligating funds because insurance is also covering it. So that's that duplication. The nice thing is because emergency work, we usually require obtain and maintain insurance up to the amount of the grant, but with emergency work or category B, that is not required. So you will not be required to obtain and maintain an additional insurance for the amount of the grant. So that's a nice thing for you. So FEMA does not provide PA funding for medical costs if it's underwritten by private insurance, Medicare, Medicaid, or pre-existing private payment agreement. So if someone is paying for, someone's private insurance is paying for that ambulance ride, then that would not be covered under public assistance funding because you would be paid by that private insurance or Medicare or Medicaid. FEMA is typically the last dollar on the table. Again, if it's underwritten by or paid for by private insurance, Medicare, Medicaid, then that would not be something you need to put in your grant. So you need to take reasonable steps to provide documentation on a patient-by-patient basis, so per person. Verifying that insurance coverage or any other source of funding, including that private insurance, Medicaid, Medicare, has been pursued. Not that you just kind of waive that for COVID. You need to pursue it as though you normally do. That it doesn't exist, and with medical care and emergency medical evacuations. So you need to pursue those payments as you normally would. Insurance, some ineligible medical care incurred once a survivor has been admitted to the medical facility on an inpatient basis. So you're pretty much, you get them there, and then your cost, hopefully, besides decontaminating, should pretty much end. The cost associated with follow-on treatments of the survivor beyond 30 days of the declaration is not covered, and administrative costs associated with the treatment of the survivors. But for your organization, this probably won't come into play. But we just wanted to give you the whole picture of what we cover and what we don't cover for a medical. Again, that cost share is, there is a split. So there is, you are responsible for the non-federal cost share, but the federal government is picking up 75% of those costs that you can document that would be eligible. So keep that in mind. There is a way to offset that 25% if you have any donated resources. So if you have any folks that are maybe volunteers, as long as this is documented, we need to know who it was, what time, what were they doing, was, making sure it was a COVID call, what equipment, any supplies or materials that possibly was donated, if you had any logistical support donated, all of those can go against to offset that 25%. So, but you've got to keep very good records, and we've got to know who, what were they doing, when did they do it, for how long, and what did they use during that period of time. So that is somewhat of a way that you can offset those costs. Now we know that doing the grant does take some administrative effort, some administrative lift. So what we're doing is we are giving you a management cost, and it's up to 5% of the total amount, the total grant. And again, that's based on the actual cost of the grant that you are requesting. So this meeting, for example, could be considered part of your administrative cost. You would, things to prepare correspondence, reviewing projects, copying, filing, submitting the documents, any type of training. We do have some guides to help you through the Public Assistance Management Cost Standard Operating Procedures. Of course, we've got the policy there for you on administrative management costs. So we would offer up to 5% of the total amount for administering or administrative costs to do the grant. All right, so now we've gotten through what's eligible, what's not eligible. How do we do this crazy grant? There is, if you by chance did some contracting, if you contracted out some things, there is an exception. We normally require, let's go to the next slide. During the public health emergency, it happened January 27th. Of course, it was declared on March 13th. Actually, yeah. And that was a nationwide declaration for emergency declaration. And now we have a major declaration. We have, there has been a waiver of how to contract. Go ahead and click, it'll fill in a little bit more. We offered that you don't have to, we've got state entities that you may sole source without having to go through the bid. But you do have to still follow, if you are going to contract anything or any work or anything, you do need to put a justification of why you chose that contract. And it's any contract, go ahead and click again, and it should cover up some, there you go. It's for any contract that you entered in on or after January 27th. So, so again, we've kind of reduced our requirements for putting things out to bid, and we are allowing sole sourcing for COVID-19, if by chance you have done that. So if you are sole sourcing, the exception, again, the non-state entity, which is you, go ahead and click. You must include the contract clauses. If you did a time and materials or a T&M contract, we need to see what those requirements were. We ask that you do not enter into a cost plus percentage cost, which means that whatever the cost is plus X amount, or CPPC contracts, because there's really no incentive for them to keep that contract cost down, because the more it is, the more the cost percentage goes up that they get. So we do not like those. That you've awarded it to a responsible contractor. Of course, you probably are, since you need the work done, and you follow all your document oversight. Make sure that there's not a conflict of interest requirement, that it's done on a fair and equitable basis. The other pieces, again, you've got to follow your normal procurement process. You've got to include all those contract clauses. Again, if you use that T&M, we need to know if you do happen to get into a CPPC, a cost plus percentage cost contract, even though we do discourage it, we do look at it and determine what is a reasonable cost. So there's a chance that not all the costs would be covered if they're considered unreasonable. So All right, what kind of documentation are we looking for here? There's a lot. Once your organization has been approved into grants portal, and to get your account approved, we're going to need, if you're a private nonprofit, we're going to need your charter and your bylaws. We're going to need to see that you own a facility, or also if you are doing this under contract with a county or city to do those services for them, we need a copy of that. We also need your tax exempt status, your 501c3, or your state requirement showing that you are operating as a private nonprofit. So that's why we need those kinds of documents before you can actually get your account established. So once you get established, so you've jumped through those hoops and loops and got your account established, the other thing we need is your personnel pay policy. We want to know how folks are being compensated. The main thing we're looking at is Category B, only for FEMA public assistance. Category B, only the overtime is considered an eligible cost. So we need to know, I know, our EMS folks work different shifts and crazy times, and what it takes to get overtime. We need to know what that is in your pay policy. If there's any labor or union contracts, we need that, and we need the full insurance policy. So those are the things that you would actually upload into Grants Manager. Now here's a nice little chart that kind of lays it all out of what kind of documents do I need. So if you're a career EMS with no volunteers, what documents we need is the ICS 202 form, the 204 form, your shift records, which is basically your who worked when. We need your pay policy. So you're going to see those checked, and you're going to see 202 and the 204 checked for everything. The 214, which is your calls, we need also identified on that which ones were COVID. We need all receipts. So if you purchased any items, we need either invoices or receipts, or however you track your purchases. There is a tracking Excel form that is out there that you can enter this in. You don't have to put it on FEMA forms. If you have a great software that you can just spit out this information, we will take that. But we also do have FEMA forms just in case you don't have those items or that level of technology to be able to give it to us. And then the Streamline Project form is now built into Grants Portal. So you will not have to download this form and then upload it into Grants Portal. We have now built that in so that you just, if you've ever done TurboTax, it's kind of like the Grant TurboTax for public assistance. It'll just walk you through questions, and you don't have to do it all at once. If you can leave it and you can come back and you can resume to it. It's available 24/7. So regardless of which shift you're working, it's available to you. So same types of things with the career fire and EMS. With volunteers, we need all that information, the same information. If you're a volunteer EMS, you will need the agreement with the jurisdiction to give you the approval or show us that you have the authorization to be doing what you're doing. So I'm sure you probably have that if you're a volunteer EMS. The other is if you're a private nonprofit EMS or contracted fire, you would still do all of those documents. You would not be doing the streamlined form. You would be doing the agreement with the jurisdiction. And if you're a for-profit, you will actually not be doing a FEMA grant request. You would actually submit all of your information through either that state, city, county, locality. They would be filing as the eligible applicant, and then in turn, they would be looking from you for the contract and those costs, and then that would fold in under their claim, and they would in turn pass the money on to you. So, so those would be the options for you. So hopefully that little chart helps you to understand who and what and where we are. So the start now and go backwards, or at least start now and go forward, and then you can slowly work backwards. The regular and overtime hours we need to know, because the equipment is actually an expense that we allow. So, you know, your vehicle, when it's on a COVID call, we allow equipment rates for that. So that's why we need to know regular and overtime hours. We need to know who was driving that vehicle. We need to know who was on the vehicle. And usually we'll find that in a lot of the logs as you do those. But we don't want to miss out on getting the reimbursement for the type of equipment that you're using. Any supplies and materials, it can be from stock. We just need to note that. Or it could be things that you just purchased. We need to know how many of those items you used on that call. So tracking is the biggest hurdle that you probably have to face to get the grant. Again, we're asking for all the documentation that you can give us to show that you use that. There is a disaster response cost recovery Excel workbook that is available that Mr. Dave Donahue has put together for you, and I'm sure that they will make that available to you on your website. Again, we don't care which kind of documents you put it on, we just need the information. The other thing is you need to keep your records. According to the Stafford Act, it's a 3-year limit on FEMA's authority to recover payments, so you could be susceptible to an audit. So you need to keep all the originals. The nice thing is with us being in a virtual world, at least we know that we're not going to have any original documents. You're going to upload those into Grants Portal. You need to keep those documents for 3 years after the date of your very last payment. So you maintain all the originals and you just keep those documents. They're subject to an audit by state, FEMA, Department of Homeland Security, Office of the Inspector General, or the Government Accountability Office. So any of those folks could come knocking on your door and let you, when they audit your grant. So let's walk through what happens to put in the project. What I'd like to show you first is where do I find all these resources? You know, where can I get it? This is what Grants Portal looks like once you have an account. Up at the very top, as you can kind of see, it's user-friendly. On the left-hand side, you have a series of menus. Up at the top, there's a nice little question mark, and that little question mark will actually launch the support center. And then under that, you will see if you know, if you need to contact us, that'll give you the number to the hotline that is a live person that will answer your call and walk you through any issues with Grants Portal. But you really need to click on the resources. So when you click on resources, let's go to the next slide. There you go. You can see there's a whole bunch of resources. You'll scroll down to the very bottom, and at the very bottom is the Streamline Application Overview. So that you would just click on that hyperlink and it would actually take you through everything that you need to do in the process of putting it through. So it's kind of like a help guide. Now, there is lots and lots and lots of FEMA fact sheets. There's the Public Assistance Program Policy Guide, the Papa G that I was referring to. That is all the FEMA policies and program implementation. So you probably want to pay attention to, I believe it's page 44 is where we, or 43 is when we start talking about private nonprofits. So that would be where you would want to look. There's as you can see, we've got a lot of COVID-19. We've got it for private nonprofit organizations. We've got them for non-congregate sheltering. We've got emergency medical care. So, so all of those items, they're available, and they give you a whole lot more detail. I could go through them, but you probably would be here for a while, and I know you've got other things to be doing as you go through. So these are all on the FEMA.gov website. You can just punch in COVID-19 or search COVID-19, and it'll bring that up. Or I'm sure that on your website they will be able to put these nice little links for you. So which schedule is required? You kind of think of this as a tax form is probably the easiest way. You know, you do your 1040, or you may do an EZ, and then you may do different schedules. That's kind of the easiest way to think about this. But the biggest thing here is the minimum project cost. The minimum grant or claim that you can make with FEMA in public assistance is $3,300. So you must have at least that much in that you're requesting in the grant that you can document. If you don't, then it is an ineligible, because we don't even look at it unless it's that amount or more. So once you meet that minimum threshold, then there's a couple of more questions. Is it less than $131,100? If it is, then that's what we call a small project. And so the forms that you would fill out is just one, possibly two. That would be kind of like the 1040 EZ. So that would be the PA COVID EZ form. And if you had any category, or the Schedule F is for environmental questions. So we'll ask environmental and historic preservation questions. If you had any temporary facilities, those kind of things. And again, the grants portal is logic based. So based on the answers that you have, it will determine whether you need to fill out a Schedule F or not. And it'll pop right in. You don't have to know that these are the ones you have to fill out. The nice thing is all of this is now automated in Grants Portal. If your entire grant claim that you're putting in is above $131,131, it's considered a large. And the other question is it complete? Is it in progress? Chances are yours has already started. But that would determine most of the time, since the incident period is continuing or still ongoing, chances are if you did a claim, it would be in progress. And so you would have to fill out a Schedule C and D. But again, you just go in, you answer the questions, and then these schedules will pop up. Now that it's automated. We used to have it paper, so lucky for you, you're now getting it automated. So what are the next steps? What do you do from here? The next step is to get yourself a grants portal account. So again, if you're a private nonprofit, then you need to contact your emergency management agency or your emergency manager and have them set up an account. If you already have an account, go in, log in, and submit a request for public assistance. Right here, you will see, this is our YouTube channel, where you will find all kinds of videos of establishing your account, how do you do a COVID grant, how do you manage personnel in the software. It walks you through all kinds of things. There's, I believe, 17 different videos that are there for you. If you have any questions about Grants Portal, getting your account, what's the status, the hotline will be able to help you with any Grants Portal questions. They don't answer eligibility questions. They're just there for software support. If you do have some questions, you can go to this web address, FEMA-recovery-PA-grants. You think we got enough dashes in there? At FEMA.dhs.gov. And you can ask any question in there, and we can get it over to our policy folks for eligibility questions, or if you, if our hotline is not open, and you want to go ahead and send an email, then this is where the hotline monitors this this inbox. So we've got plenty of resources for you. The biggest thing to do is get the account and get that request for public assistance in there. And so here's the next steps for you. Submit any of your questions, of course, after the webinar to Mr. Dave under david.donahue@fema.dhs.gov. And I believe that actually concludes my portion.
Thank you so much, Star, and as well as Chief Bryant, for this enlightening presentation today. We're so grateful for your time and thought. I just wanted to take a moment to assure everyone that all of the questions that they submitted through the Q&A box have been screenshotted and recorded, and we will send those over to david.donahue@fema.dhs.gov, which is the same email address that's on the screen if people have questions after the session, so that they can be addressed as a group, because we've got a bunch of similar ones. We'll get them compiled, deduplicated, and sent your way shortly. So thanks to everyone for submitting questions as well. So once again, to our panelists, we're so grateful for your time and thought. We know you're very busy in the COVID-19 emergency. Chief Bryant, it looks like did you have something that you wanted to say to wrap us up?
Just again, thanks for the opportunity to be with you and the AAA. Appreciate everybody that took the time to listen. We hope that this information was beneficial to you. Again, any questions specific to this, fire them away. Or if you just have any questions about any other aspect of the federal government's role and response to COVID-19 and how that might be of help to you, let us know, and we'll be sure and direct that in the right way. But on behalf of the United States Fire Administration and FEMA, just have to say thank you to everybody for the really remarkable and inspirational work that everybody's doing out there during this time. Again, if it was just a pandemic, it might be one thing, but we've certainly had some other things here of late to pile on top of that too. So appreciate the work that you're doing out there, whatever your role in your organization may be. It's a significant contribution to this national and global response to this pandemic. So thank you all for that great work that you're doing, and let us know how we may be of help to you in any way.
Thank you once more, everyone, panelists and attendees. And this concludes today's broadcast. We hope to see you at a future webinar.